Now we start scanning the pelvis. Here we see the gut loops. The gut loops are prominent here and containing fluid and food particles. Now we continue sliding to the right iliac region to follow the gut loop. Here the small intestine is connecting with the cecum. The wall of distal ileum are thickened and prominent due to inflammation. Here we see the cecum which contains gases. Now we sliding the probe here to up and down. Here we see an hypoechoic area below the small intestine. Here we see another lumen. We see no peristalsis in this lumen, and the proximal part is swollen and shows heterogeneous texture. And this is distal end. This is the appendix which is inflamed and a heterogeneous mass in the proximal part of the appendix. Here we see the ill-defined debris collection in the soft tissues. The surroundings of tissues are inflamed and edematous. The appendix lies parallel to the distal ileum. This is ideal location of appendix and is difficult to locate when there is gases in the distal ileum. Remember that when you find the distal ileum walls are inflamed, it means appendix could be present because the walls are inflamed due to acute appendicitis. Sometimes the walls of distal ileum and cecum are mildly inflamed, but appendix cannot be found. But when the walls are inflamed and thickened, they occur due to inflammation of appendix. This is cross-section view of appendix. By rotating a probe at its axis, now we will measure the size of appendix. The anterior posterior diameter of appendix is 9 mm. The normal diameter of appendix is up to 6 mm. Here we see the ill-defined fluid collection is also present around the appendix. Now we will scan the pelvic area to scan any other collection. These are muscle layers. The collection is present only around the appendix but not spread in the surrounding tissue. This is proximal part of ascending colon. The walls of ascending colon are also inflamed. The echogenic layer is submucosal layer. And hypoacuic layer is muscular layer. Now how we will write report.